Hello, everyone. I'm Miguel. I am the financial planner and nurse leader for the Prospective Azusa Diabetic Wellness Center. I appreciate you all for taking the time to meet with me today as I discuss our ideas for establishing a new diabetic treatment clinic. So you might be thinking right now, well, why should we open a new clinic? Well, to address that question, currently the main hospital, Azusa Regional Medical Center, AZRMC, currently experiences um, a high inflow of patients. Actually, they receive more than 30 a day on average that require um, definitive treatment for diabetic related complications such as non healing wounds, as well as poor blood glucose control. Currently, these patients must often wait to be admitted to an available hospital bed and often experience significant delays in care due to the high patient impaction at AZRMC. Actually, many of these patients that require wound care at the hospital have to wait 24 to 48 hours on average to even be seen by the wound care nurse. This reflects a significant deficit in attention and care being provided to these patients. Um, and such delays in patient care can lead to significantly higher risks of complications such as infections and may complicate treatment, cause longer stays, both of which can increase the cost of treatment as well as for the hospital, as well as the share of costs for the patient. Therefore, senior leadership at the main hospital, as well as myself, feel that in order to better provide care to the diabetic population of the area, as well as improve cost effectiveness of treatment, we are proposing the launch of the new Azusa Diabetic Wellness Center, a clinic designed specifically to treat the diverse needs of our diabetic patients. The new clinic will not only provide treatment for diabetic related conditions, but also be a place for pre-diabetics to be initially seen and assessed for any onset of symptoms and conditions related to diabetes. The importance of this is to ensure that these pre-diabetic patients are assessed and monitored frequently and get under strict management, disease management, so that they do not progress into diabetes. A major advantage of developing the new clinic is the large potential patient population base of diabetics and pre-diabetics in the area. So ideally, patients will be referred to from the main hospital itself, as well as the surrounding area, to the clinic. So the motivation for the AZRMC staff to refer patients to the clinic is that by doing so, they will reduce the patient load on the main hospital, as well as reduce the strain on the staff and limited resources at the hospital. Additionally, something to keep in mind is that current research suggests that the diabetic population in the surrounding LA area has consistently been growing over the past couple decades, suggesting that patient influx and associated revenue and will likely continue to grow in the future as the patient population of diabetics continues to grow. The clinic can greatly benefit the community by helping patients to get better control of their diabetes and prevent further progression or development of complications and reduce the risks of hospitalization. A major disadvantage or challenge that we anticipate for the new clinic is that there are already a few clinics throughout the city which represent potential competition for patients in the area. However, our proposed clinic is unique and niche in the fact that it addresses specifically the needs of diabetics. Operationally, so for the first month or two of our timeline, we considered this time to be vital for training and hiring of new employees for the clinic, as well as hosting conferences. So in these conferences, we intend to set up an investor conference. So in this conference, we intend to meet with potential investors and discuss the potential benefits of this clinic to the investor, as well as our business plan and what we intend to do with this clinic. in order to hopefully provide for further funding for this clinic. The first year or so of this clinic, we anticipate rather reduced revenue simply because the clinic is new, and patient influx is anticipated to be rather low in the first several months of opening. Additionally, another conference will be made with AZRMC staff. So this conference will involve nurses as well as providers of the main hospital. This conference will be geared towards providing data surrounding diabetes and pre-diabetes prevalence statistics, as well as potential complications of poorly managed diabetes, as well as the benefits of ongoing clinic monitoring of a person's diabetic condition. So the conference will provide continuing education hours as an incentive for staff to attend. And also these conferences will double as a vehicle of dispersing marketing materials. So things like brochures, pens, flyers, and posters will be disseminated during these conferences, so that these can be posted and distributed across the facility. These materials will have the basic details about the clinic, as well as contact information for the clinic. Additionally, the area census data has suggested that the area is strongly composed of Spanish speakers, and so for our marketing, we are going to be utilizing everything will be printed in both English and Spanish to promote widespread awareness of the clinic to both English and Spanish speakers in the community. Apart from those materials, we will also be implementing newspaper ads as well as Google ads to outreach for younger and older patients within the area. Because diabetes is so widespread across different age groups, we wanted to use a sort of shotgun approach for our marketing methods to try to reach as many different patients across different demographics via a number of different ways. In the first 6 months or so of our operation, following recruiting and training staff as well as the conferences, we anticipate initial patient influx to be rather slow but gradually increase. So revenue will primarily be derived from patient insurances as well as a small amount from patient self-pay. We anticipate that the clinic will reach full operational capacity around the 6 to 9 month mark, as the pace begins to quicken up and patient influx begins to increase. And awareness of the clinic will also increase during this time. Because diabetes is a chronic illness that requires ongoing treatment, we anticipate that many of these patients will actually become recurring clients and therefore be useful for creating a stable revenue source for the clinic. Assuming that the clinic reaches full capacity by the 6 month mark, we anticipate for our first year, our estimated net revenue will be around $70,000 to $80,000 net profit, with a net profit stream of approximately $20,000 to $25,000 per month. The reason for the low revenue in the first year is primarily due to low anticipated patient influx in the first several months, as well as covering for our capital expenses. Capital expenses include things like such as our exam tables, medical equipment such as our venous stasis, ultrasound, ophthalmoscopes, things of that nature. These are expected to cost us approximately $65,000. Other startup costs would be included, such as the EHR implementation, licensing of the building, as well as purchasing supplies. Second to the capital expenses, salary and benefits would probably be our largest expense in terms of operation. So for our clinic, we anticipate hiring 2 wound care nurses to provide routine wound care for our patients, 2 diabetic nurse educators to conduct initial patient assessments, education, and follow-up visits, 1 nurse practitioner to oversee the clinic, provide general management for the clinic, and provide prescription power to allow patients to allow management of the patient medication regimes. And then as well as 2 medical assistants to assist with patient intake, vitals, and prepare rooms, as well as other preparatory tasks in the clinic, and one office receptionist to assist with administrative tasks such as gathering basic patient information, insurance, and directing phone calls. Expenses for the staff, salary and benefits is estimated to be approximately between $60,000 to $65,000 per month, depending on hours and overtime provided. Overall, our clinic is expected to improve the care that diabetics in the community receive. Specifically, we anticipate the clinic to improve diabetic self-management. So AZRMC is currently experiencing a significant fall in patient preparedness. So patients responded in surveys that many of them feel less prepared to care for their diabetic wounds at home. And so this was a specific outcome that we wanted to address in starting up our new clinic. So hopefully by starting a clinic that is more directed towards the needs of diabetic patients, these patients will have a greater access to healthcare, to services. They will have more access to diabetic education, as well as faster time for initial treatment of their diabetic related issues. So a way we could evaluate if patient management is improved would be various metrics such as assessing their A1C levels, as well as their time spent in normal glucose range. Additionally, other major outcomes we hope to improve by implementing this new clinic is a reduction in hospitalizations of our patients. So by providing closer monitoring and more directive care towards these patients, we hope to reduce the complications that occur that would require hospitalizations, as these hospitalizations are quite costly and expensive to both the patient as well as the hospital, and these complications could obviously lead to poorer quality of life for these patients. So preventing them via the clinic would be ideal. Another aspect that we hope to improve would be wound healing rate. So by providing more frequent and more accessible wound care at the clinic, we are hoping to improve the wound healing rate for these patients, allow them to more frequently visit the clinic, as opposed to having to wait several days at the hospital to be admitted and seen by the wound care nurse, as currently is the situation. And then by having a clinic staff and resources dedicated to treating various diabetic conditions, we anticipate such a focused approach would improve overall patient satisfaction, as well as improve the likelihood of patients returning to the clinic for their future care needs. So by improving the patient's care satisfaction, hopefully they will most likely choose our clinic in the future, and obviously this would be important in terms of our revenue stream. So ultimately, we do find that this clinic can be very promising in terms of improving the care provided for our diabetic patients in the community. And so moving forward, we hope that you consider our proposal and the potential benefits it can have in the community. So With that, we conclude this meeting. So thank you so much for your time. If you have any questions or concerns, I would be happy to address them at this time. So thank you.